The purpose of this video today is to talk about the medical program and advocate for patients.
So my name is Dr. Kat Lopez. I'm an integrative holistic general practice physician here in Happy Valley, Oregon. And due to patient demand, I have had to learn a lot about medical cannabis because I work with a number of chronically ill people who were asking me, hey, could this help me? And I thought, I think it could. And then they said, how? And I had to learn how. So in this conversation today, I was hoping to clarify and transmit some of the basic safety information.
I'm Tricia Quick. I'm a registered nurse for about 20 years, and I work at home health hospice now. So there's a big difference since the legalization of marijuana, and there's definitely been a good, how long's it been? 6 years that it's been legal medically. So things have been changing, and now we're seeing way more cannabis in the homes. And then especially with hospice, people are more willing to use it at end of life. And there is no information in the medical world that they can go to. Their doctor, not even the oncologist who prescribes it, has information. So they're kind of out there lost, searching, doing their own research, if that, and they're pretty scared about it because there's nobody really supporting them. Doctors do write the prescription out for the card, but then they can't explain it. So then we have these people at home confused. They're also taking medication. So then there's the interactions. What are they taking? Who's watching them? Who's helping them dose? And again, a lot of them are turned off by smoking, and a lot are turned off by the psychoactivity that the THC causes. So, there's just not a lot of us out there. And I feel like the medical world is going to have to get on board, especially with the opiate problems that we've had, all the deaths and the increase in death. Now there's an increase in suicide for pain patients who've gotten cut back. And so we're going to have to get on board with cannabis is my thought. People are way more open here in Oregon, so it's time to educate. And the patients especially need to know what they're doing, And the dispensaries, they're trying to help, but there needs to be some sort of education in there too.
As a researcher, looking at numbers and statistics and consuming cannabis for medical purposes, if you use it as a suppository, you're getting 85% medicine. If you're using it as an edible, you get 35% medicine. And if you're smoking it, you get 15. So part of the lack of education is that eating a candy bar or eating a gummy bear or eating a honey stick is not treating your chronic condition medicinally. It may be adding to the problem because of what sugar does to the immune system when it's compromised. So part of, for me, the issue of sort of the industry side of things is that they're not considering medical patients and thinking about medical patients in what they're doing. They're just thinking in terms of consumerism and capitalism. And it's not working for the medical patients. So what's happening is we don't have any information to connect in with. And then we're also getting the wrong information, the wrong dosing, and then that's creating patients to say, well, this doesn't work for me. I tried it once and it doesn't work.
Yes.
No, it does work. We just have to work with what is going to work, what method is going to work, and taking it one step at a time per dose. But we're not taught to do that. We're just given a card and say, here, go to a dispensary and find something that helps you, while listening to somebody that may or may not have that knowledge base. And it's a problem. It's not being thought of as a plant medicine, and it's not being used as a plant medicine in the general population of dispensary use.